Good morning. Good morning. What do I want to? This is part 2 of my conversation with a grieving mother. It's been, almost two and a half years of the passing of her son in Dominica from an accident. But you could tell that she continues to grieve, and who blames? You can't blame her. But the things that she's telling me, and it's not just telling me, I've seen evidence of the gross negligence. In my first video, I talked about 16 or 17 hours before they could get him to the ICU, 10 hours before they could get him down out of the hospital to another place to get a CAT scan to bring him back, 16, 17 hours before they could put a breathing machine down on a mentally declining patient from a head injury. But what she told me that blew my mind, was greater than 24 hours, they gave her a prescription to go and get a medication. This medication we call TXA, tranexamic acid. And we give that in the acute phase of trauma to stop bleeding, right? The literature pretty much says, within 3 to 8 hours, you give it to the patient. And it's about $30 to $40 a dose up here, right? And actually, even the EMS and the ambulance can give it, right? They give her a script. 24 hours later, her son is now deteriorating in the ICU to go and get this medication. And what I'm going to tell you now is going to blow your mind. I said to her, how much did this medication cost? Because we use it very frequently up here, and I know it's $30 to $40 a dose. She paid over 500 US equivalent for that medication. But you know what bothers me? A doctor should know that giving it to that patient that far out, greater than 24 hours, is not going to be effective. You sort of pass that window, and you're giving that mother that extra expense to go get a medication, right? You don't have that medication in the hospital. It's something that you should have in the emergency room to give patients when they come in, or in the back of the ambulance. But you're giving a script. See, that is where the system is broken, right? There are certain medications that you should stock in the ambulance. There's certain medications that you should have in the emergency room, right? Not give her a script for a medication 24 hours later. You know that's not going to work. And for her to spend $500 US to get that medication, and 2 days after that, 2-3 days after that, it's a futile care. I'm not going to go into too much detail, but he ends up dying. One scan done at an outside private CAT scan, because there was none available in the hospital. This is what we're talking about, people. The things that she's telling me is gross negligent, and I'm not gonna get into medical legal mumbo jumbo, but she is not the only one. A lot of people reach out to me, right? A 20-something-year-old patient just, that could have been saved. Even if you have the patient in the emergency room and you suspect a head injury, you think that, a pupil is blown, a pupil is sluggish, right? You get the mannitol, you get the 3% saline, and you start treating the patient. You should have a scanner available and ready to go to show you what's going on. And if there's blood that needs to be evacuated, you need a surgeon to evacuate this blood. These are the things that young people are dying. That's why I said no one survives accidents down there, right? And so many people are asking me to help them get screws and plates for broken bones because they can't afford it, because it's $12,000. Man, we need to rise up against the machine. Look at how much money has been spent on hotels, and everybody's rich. Everybody have hotels, even giving away dividends already. Sad.